Hi, everyone. Thank you for inviting us in tonight. Today, I'd really like to talk about, I suppose, my experience as implementing Shockwave in my clinic and this sort of story of making sure that what we hope to do as clinic owners when we make an investment in medical technology is to make our business more sustainable so that we can continue doing what we're good at. And I think Shockwave has been a really good investment for my business. And I'd like to sort of talk through that because one of the things that popped up was initially when I implemented Shockwave into my business and I sat down and sort of crunched the numbers in the first year, I'd actually made a loss in terms of how much the unit cost me versus how much money it generated for my business in terms of return. I had to make some adjustments to that, and Shockwave now reliably provides over 200% return on investment every year. So it's providing just positive cash flow for my business. And that really makes my business more sustainable. It means that I can invest in technology, I can invest in growing my business. And Shockwave has been a really useful tool for that. And the biggest thing is, and we're going to talk about a few of the reasons why. But the reason I incorporated Shockwave into my clinic is one, I'd had a long-standing history. So when I first left uni, my first job down in Gippsland, we were one of the first group of clinics to implement Shockwave. So it's something that I'd really used pretty much since graduating. And it's a treatment that's non-invasive, and it also has an excellent safety history. I've never had a serious adverse effect in over 10 years of using Shockwave. And it's really also fast to perform. It doesn't take a lot of time, so your clinical time is valuable, and it's not a treatment that takes a lot of time. When I compare this to something like an injection, if I'm giving an injection for, for a heel, for example, I'm often doing a tibial nerve block. All of that takes a lot of time. That's considerable clinical time that takes up. Shockwave is a much simpler procedure to perform. And the biggest one for patients, I think, is there's no downtime. The efficacy of the EMS dollar class is also validated. Of the PEDRO database, which is the physiotherapy evidence database, 32 of the 64 trials that are listed on there are using an EMS device. And our EMS has over 30 clinical RCTs demonstrating efficacy. And when it comes to a radial device, it's really the only one with FDA approval for efficacy. And there's a difference between the TGA approval and the FDA. For the TGA in Australia, you've basically got to prove your medical device is safe, but you don't have to prove that it works. In the FDA, on the other hand, for it to be classed as a medical device, the onus is on the manufacturer to prove that it has efficacy and it's effective at doing what it wants. And also as a clinic owner, it expands your treatment options. The more tools that you have at your disposal for improving patient outcomes, that's ultimately what we're there to do. We're there to solve clinical problems for our patients. They may be, the patient comes to us with a painful Achilles tendon, and that tendon might be getting in the way of them living a, fully integrated life that, activity, exercise, all of those things. So they come in usually because one, they're in pain, second, because it's causing functional limitations and so forth. And it's also a non-drug based treatment, which is really important. A lot of patients are interested in treatments that are non-drug based, whether it's, this is increasingly something that patients are looking for. This study here, I think this highlights to a degree when we're treating these chronic tendinopathies, fasciopathies, these are difficult conditions to treat. They're often chronic, and we often see patients that have often present after 6, 12, or 18 months of being in pain. And this study is a follow-up of the eccentric heel drop program for Achilles tendinopathy. And what's interesting, and the reason I like it, is a 5-year follow-up. Most trials only go for 6 or 12 months, and that's it. So we don't really get to see the full length of the patient follow-up. In this case, we're just looking at 58 patients, 70 tendons, And the interesting finding was you had 60% of them still had pain. And nearly half of them had tried additional treatments in addition to that. And there can be a whole number of things that treatments fail, whether the heel drop program failed. Some of that can be the patient's in pain when performing it. Sometimes it's compliance. There's a whole bunch of things that can go into that. But the reality is that you need to have more than one sort of tools in your toolkit. Again, with a lot of these chronic conditions, what often happens is when a patient is not progressing sufficiently with either, if we're dealing with, say, Achilles tendinopathy, for example, the standard approach might be giving them some advice on footwear, potentially using some heel lifts, an exercise program, looking at load management and all of those various things. In some cases, despite doing all of those interventions and advice and rehab programs, the patient's still in pain. And, when it comes to heel pain, for example, or plantar fasciitis, a really common approach is, okay, maybe it's time for a cortisone injection. And we can see from this study, this is using dexamethasone, which is a cortisone, and it's comparing it to a placebo. So the patients were each allocated into two groups. One group received an injection of saline, and the second group got a cortisone injection. Now, both groups improved over time, and at 4 weeks, the cortisone group did better than the placebo group who got the saline. But if you look at the 8-week point and the 12-week point, there's not a statistical difference there. So it's not always a good option. And we tend to know this as practitioners. We've seen the patients who have had multiple cortisone injections, and it does provide, in some cases, relief for a period of time, but that ultimately wears off. Look, having used PRP as well in my practice, PRP is another approach that can be used for injection therapy. It can be unpredictable. Some patients get a really good response. Some patients get a big flare-up of pain. And it can be sometimes difficult to determine which ones are going to proceed really well with that versus which ones. So for me, I really sort of stopped using it because I found the reliability in terms of patient outcomes was not great. Some patients did do really well, and other patients it would cause a big flare and it would take time to settle down, and that had an impact on their life. Shockwave, on the other hand, doesn't cause that same degree of it doesn't impose itself as much into patients' lives. They can continue working, they continue with the exercise that you've got them on. Look, one of the things I do when I describe Shockwave to patients is I sort of talk about it being often a reset for chronic pain, and it's part of my overall treatment plan. So the primary thing as healthcare professionals are the diagnosis is really important, and making sure you're really working through and developing a proper treatment plan for the patient. Shockwave often features in my treatment plan, but it's also I use, and if you have a look at one of my other lectures, I really find the timing of Shockwave to be really important. So on the EMS database, you can go in and have a look at previous webinars, and I've done one on improving clinical outcomes. So that's something to consider, but I describe it to patients being sometimes a reset. So with these chronic injuries, sometimes despite doing all the right thing, the pain is still there. The patient's still in pain, and it's not progressing. It's got to a stage where it's stagnated. And Shockwave can be that sort of stimulus where we're trying to hit a bit of a reset. The reset helps often with two things. One is the software, and this is that initial pain relieving that the patient experiences often when you first complete the treatment. So after you've treated their heel pain or their Achilles tendinopathy, the patient stands up and says, "Oh, that feels a lot better." That is more in terms of reducing pain. It's causing a bit of a desensitization. It's changing the software. In terms of the more long-lasting effect, this is the hardware, and this takes a bit longer. And I tell patients that, and this is what we see in the research as well. When you're looking at Shockwave versus cortisone injection, you'll often see in that first 4 weeks, your steroid group does better because it's having a potent anti-inflammatory effect on the area. It's helping to modulate pain. But Shockwave at 3 months, 6 months, and 12 months often is superior to cortisone. And the reason being, and this is how I describe it to patients, look, when I've completed a course of treatment, we are looking, 6 to 12 weeks after we complete that course to really assess how effective it's been. And I describe it as a course of treatment. So, just as with antibiotics, you can't just take 1 or 2 tablets, you've got to complete the course. Shockwave is much the same. It's important that the patient, buys into that as part of their treatment plan, because if we don't get through the course of treatment, the success is going to be quite reduced. So and this is something I think, and the reason for maybe doing this was when talking to other healthcare business owners, and they're often interested in sort of the business side of things. And it is really important as healthcare professionals that our businesses are sustainable, and they have to produce a profit in order to be sustainable, so we can continue to grow the business and we can continue to provide the services that we do to our patients. There's a cafe around the corner, which I really like. Now, I want them to be sustainable. I want them to be able to make a profit so I can continue to go around there and receive the sort of service and the things that I like there. And we're much the same. So what we're going to do here, and this is a bit of a thought experiment, it's not a prescribed way of doing things. There are lots of different ways. Different practitioners have implemented in different ways that works for their business and their business model. I'm just going to take you through a bit of a thought experiment and more show you a formula and some things to think about when you're looking at implementing a device like Shockwave into your practice. So one of the most common questions I'd get asked when talking to other business owners is really, how do you charge? What do you charge? Those sort of things. And to answer that, it really comes down to, what does it cost your business? So what we're going to do is take the average investment of a dollar class unit, say $24,000. And what I'm going to do with that is I'm going to work out over how long do I want that investment to be. You might look at either purchasing it outright, or you purchase it through a loan or a chattel mortgage, those type of things. So let's say that we're going to look at this investment, this $24,000, we're going to invest this over 5 years in our business. And I want you to think about it as an investment, because we want that to provide a return so our business can grow and be more sustainable. If it's going to make a loss, you might as well go and buy a jet ski or something you'd enjoy using as a toy. So over 5 years, we're going to take that $24,000, divide it by 5, and that's going to give us our price that the unit or the investment is going to cost our business per annum, per year. What I'm then going to do is work out the weekly cost. And I'm going to divide it by 50, because let's assume that our practice is closed for 2 weeks during the year, Christmas, Easter. So we'll take 50 weeks of the year. That investment works out to be $96 per week. One of the other things to consider is our handle refurbishment. So our EMS handles are validated to provide the sort of flux density and that energy that's been used in the trials for up to 1 million shocks. After that, the handle needs to be refurbished. The cost of refurbishing these handles is $870. But that provides 500 treatments. That's a good use. So per treatment of 2,000 shocks, you're looking at about $1.75. So if you're new to Shockwave and you're considering implementing it in your clinic, the first question to ask is, how many patients visit your clinic with a common indication for Shockwave? So the things to consider are plantar fasciitis, Achilles tendinopathy, greater trochanteric pain syndrome, patellar tendinopathy, myofascial pain. Now, a good way to model this is actually to go through your own database. So look at your books over the past, say, month or 2 months, and work out the average. How many people sort of, per week were presenting with one of these conditions? And, I'd be looking at the new patients and the review patients. They're the ones we're going to have a look at and see, these are people that are coming in with a new problem, and how many of those would fit into that. Now, you can then sort of work out and say, okay, let's just say, for example, 50% of these patients, or 60%, whatever number you choose, would be really keen to proceed with Shockwave as part of their treatment plan. So this comes down to how we price it. So let's say, for example, we're planning to use our Shockwave only 3 times a week. So we take our weekly cost, that $96, and we'll divide it by 3. And that tells us the cost price to the patient for us to sort of break even is about $32. But then consider we've got to add the handle expense in there as well. So I'm going to add that $1.70. Now, just like any other product that or service that you sell in your business, you need to work out a markup for that. So it's just the same as, if you're selling an off-the-shelf orthotic or various other things, what we then work out is the markup. So you can times that. So I've worked out, so if we're treating 3 patients a week, my break-even point is going to be $33.74. We can then times that by a markup. And let's say, for example, in this example, we're going to use a 50% markup. So it works out to be like, this is the cost of providing the treatment. So if we're doing 3 treatments a week and we want a 50% return on that investment, we're looking at a treatment cost of $67.50. And I charge this in addition to a consultation fee. The way I tend to see it is there's certain things in terms of, my consultation fee really covers the cost of, admin. It's the cost of rent for the building. It's the cost of, all of the things that are the standard things that we require for doing business. But when I introduce something like Shockwave or technology like that, if that's not built in in addition to your consult, you're sort of undercutting yourself. You're making your business less sustainable. So how can we make sure our investment's working hard enough for us? So let's say, for example, we've just got 3 patients, new presentations per week, who are proceeding with Shockwave as part of their treatment plan. We're charging our fee that we've worked out, $67.50. And look, this isn't the fee that I charge for it. I'm just giving you an example in terms of you will need to, for your own practice, change the numbers so it is individual to your own practice. You might need to change the markup. You might need to change the number of patients you see. A bigger practice might have multiple practitioners on. So you might have to adjust for that. So this $67 in addition to our consultation fee, let's take, for example, a course of treatment's about 4 sessions. So if we're getting 3 new patients a week who are starting a course of treatment, basically that works out to our machine being used an average of 7 to 8 times, 7.5 times a week. Over the course of 12 months, if that machine's being used 7.5 times a week, and this is, as I said, we're getting 3 new patients a week who are starting Shockwave, it basically works out to over $2,000 in revenue per month. And you've exceeded the cost of your investment over an annual period. So we've got over $24,300 over the course of a year. And that's just in 1 year. We often, and many people will say, look, I don't feel comfortable charging in addition to my consultation fee. We often have no problem as healthcare professionals if someone comes in with a heel pain to recommend that they go out and purchase a better quality shoe, a new Asics, Brooks, whatever shoe that we recommend. Now, shoes these days are, it's very easy. They're around that sort of $250, $270 is normal. And if we're talking about a course of Shockwave treatment, 4 sessions at the fee that we just talked about, it works out to be about that. And you've also got to compare this in terms of other treatments. So, PRP injections will set you back over $600 for a single injection. Custom orthotics aren't cheap. A cortisone injection under ultrasound guidance isn't cheap either. So in the realm of things, you've got you're offering a procedure that has an evidence base to it. And if you underprice it, what you actually sort of are doing is undervaluing it as well. So the world is a really complex place, and it's estimated that we humans make up to 35,000 decisions and choices a day. Now, many of these we don't think about in a really conscious way. When I go into a bottle shop, I haven't tasted all of the bottles of wine, so I have very, very limited information about what sort of products are available. One of the things that we use is price. And, I haven't tasted a 2009 bottle of Grange versus, a $30 Penfolds. Now, the reality is that in the price tag, I can see that there's a big difference there, having not even touched that. So if you are if you're underselling, if you're underpricing your treatment, to a degree, you can be inferring to the patient that it is of lower value, and that can have an effect in terms of, one of the things that I realized when I had underpriced Shockwave in my business was when I actually properly corrected for that, I had a lot more patients. I was treating a lot more patients at the same time. So increasing the cost in my own business was not correlated with a decrease in uptake. And that's one of the things you can sometimes, if you underprice something, to a degree, you're actually to the patient offering it as it can be a lower value thing they might consider. So this is just taking the example that we're working with. And what we're looking at is this is the direct revenue of just that additional fee, the Shockwave fee. So we're going to take that $67, $67.50, and I'm going to model it. So we can work out how much are we going to, if we're treating 2 patients a week, for example, the machine's only being used twice a week. We can see over the course of 1 year, even at 2 patients a week, we're already generating in revenue more than the unit's costing us. So we're already in the positive for just using it twice a week if it's priced correctly. And you can see the difference over time. If we're using that unit 8 times a week and it's priced at the $67.50, that is over in direct revenue from Shockwave. That's over it's nearly $27,000. It's more than the whole unit cost. And then when we extrapolate that over time, you can see there's big differences that happen. So if that unit's being used 8 times a week, you're sort of generating, close to 135 grand in direct revenue for the course of your $24,000 investment. If it's being used twice a week, you're still generating positive, but it's, around that sort of, 30,000. So this is just a way of giving you an idea of how you could potentially look at implementing this in your practice and how you can actually go back and use your own real data in terms of going back and looking at your own clinical notes and looking at how many patients are presenting. Take in mind that when you start treating patients, you tend to find that you'll attract more of them with time because those patients are telling their friends, oh, you've got Achilles pain, I had Achilles pain, I went and saw this person, they used this treatment. So a lot of the patients who come and see me for Shockwave is word of mouth. I've already treated friends or family of theirs. Now, that was the direct income. Let's say, for example, we look at the combined income. And this is when we bill in addition. So I've taken, again, this is just projected. Let's take that $67.50 and we're going to combine it with our consultation fee. And I've taken an average consultation fee of $80. That works out, if we're just doing 4 sessions, 4 treatments a week, our machine's being used 4 times a week. Over the course of our investment, which is a 5-year period, we're looking at nearly 150 grand there. So these can be really useful in terms of, one, providing excellent patient outcomes, growing your business, providing more treatment options so that you've got more armament to deal with these difficult chronic problems that we see, but it also can be very valuable to growing your business. If we have a bit of a look here in terms of, and this is just looking at the annual return on investment. So if we look at just 2 treatments a week, we look at the blue here is the cost of that investment. So, and you'll see how it's the same in each one. So the cost is the same that it cost us. The green is our running cost, and this is the handle in terms of, I've worked out that. And then we've got profit. So if we're charging that amount that we've projected, at 2 treatments a week, the machine's being used, we're still generating sort of over $1,700 in profit. If you then look at using that at 8 treatments a week, you can see that your running costs haven't really increased very much at all, but your profits increased quite a lot. So the more that machine's being used in your practice, the more it's generating its own revenue. Now, I'm going to show a bit of an example here. So let's say, for example, we use $15 as our treatment cost in addition to our consult. You can see here that at 2 treatments a week, we're actually making a loss of nearly 3.5 grand. It's only when you get up to doing 8 treatments a week where you actually start to get a bit of profit. So we've got a $500 profit. So you can actually see if it's underpriced in your business, how much harder you have to work in order just to break even, if not make a return. And I think no one would rightly buy product from one of our medical suppliers and sell it at below market cost. You're guaranteed to take a loss. And I don't think you should be doing this for a medical investment either. Buying something that's costing you more to offer to your patients. It has to be, it's not a sustainable way when it comes to, purchasing new technology, investing in your practice, investing in, marketing, however you choose to grow your business. So what we're going to do here is, just like the super ad, we're going to compare the pair and look at the break-even point. And we're going to use 2 clinics as an example. So Clinic A is charging what we were talking about, this $67.50. And what we're going to do is work out what's our break-even point. So we divide that by the cost, the annual cost of our unit, $4,800, and that works out to be about 70 treatments. 70 treatments works out to be roughly 18 patients, because we're looking at an average of 4 treatments per client. So at 18 patients, anything beyond that in the year is going to be generating positive return for our practice. If we look at Clinic B, on the other hand, we're looking at basically $15 per treatment. And with that $15 per treatment, we're looking at having to do 320 treatments to get to our break-even point. That works out to be 80 new patients, or 80 patients that have gone through an average of 4 treatments. So you can see that even though the price isn't a huge difference in terms of what the patient pays, there's a huge difference to your business. You have to recruit, or you have to treat a lot more people just to break even. So when you're doing your modeling and you're working out, how do I implement this in my practice? This is where working through these things can be really helpful at making sure that it's a good investment. Now, this is, in terms of marketing, there are really a few different things. There's some advice, I think, looking at practitioners. One of the best ways I find to encourage referrals from other practitioners is writing letters. It does take a bit of time, but it's often one of the most valuable ways. When I see a patient who we've treated, most patients are really appreciative if you write a brief letter to their GP explaining, their diagnosis, their treatment plan, those sort of things. And it's a really good way to highlight your clinical thinking, your clinical skills, and then also updating them on the functional differences. Okay, we've seen, Mrs. Smith suffering with heel pain. We've undergone our course of radial shockwave. 6 weeks later, I've reviewed her. Her pain's reduced by 80%. She's back walking regularly with friends. She's back doing the sort of, those sort of things are really helpful. And patients talk to their own practitioners. They talk to their physios. They talk to their chiropractors. They talk to their doctors. And those are things that are really persuasive for practitioners. It can be, you can sit down and talk to practitioners, but I think they really like to see their own patients come in and say, look, I've had this done and it's worked really well for me. That's really powerful. Word of mouth is also a really important thing. And I find this is probably one of the more, I find most patients, I get a lot of patients for Shockwave through word of mouth. These are patients that have a friend or family member has told them to come and see us for that treatment. And also utilizing in clinic as well. So, we've got, if your waiting room has a little flat screen TV on there, having a PowerPoint presentation that's running through, just highlighting the different things that you offer can be, really helpful. Patients are coming in, or a welcome, a welcome pamphlet as for new patients that highlights some of the things you do. because your patient might not know that you provide that treatment or what it's for. So some really basic education, because when it comes to shockwave therapy, even when I advertise, in terms of in clinic or on the website, patients themselves are generally not looking for that. Is that's not their search term that they're looking for. Their problem is, I've got a sore Achilles tendon or I have a sore heel, and you've got to almost educate them about the different options that are available. Patients, if you talk to random strangers in the street and you explain shockwave therapy, most of them will have no idea what you're talking about or what it's used for. So the patients aren't necessarily searching for it. Some patients are, who have had friends tell them, look, this is something that I had done. That can be useful. But in general, patients are tending to look for their own, I've got a sore heel. Who fixes this? What sort of treatments are available? And we've got, and this is something I'd really like to ask Danny, because Danny is our EMS marketing guru. And this is something that I'm not very good at, sort of social media. And what are some powerful tips you could give for, social media, improving your clinic social media and actually sort of getting the message across for Doloclast?
Absolutely. Thanks, James. I think social media is a really great way to create wow for your brand. And Shockwave is a way to set yourself apart from competitors, because you can show, that Shockwave is long-term pain relief, clinical proven, no medications, no needles, no steroids, no surgery. It's completely minimally invasive. So it's a real win-win for the patients. We're going to be launching some social media templates and copy to support you in your Doloclast journey. So that will be released in the coming months. But I think it's really important. I think everyone's just jumping on social media right now. But my biggest tip would be, it's really important to choose a channel that's targeting your key customers. So, for example, if you've got a practice in Castle Hill, this is in Sydney, which has one of the highest medium ages, you're most likely going to be using Facebook as your chosen channel, because that skews a little bit older. You're not going to be choosing TikTok. Whereas in Bondi, obviously skewing younger, you're going to be obviously choosing TikTok, YouTube, Instagram. But another key tip, I would say, that if you're setting up a channel page, yes, okay, it's important to set it up for your practice. But one thing I will really say is that if you're practitioners yourself, your personal brand is extremely important. So set up a TikTok page or set up an Instagram, depending on your chosen audience, and promote yourself. And we're finding that a lot of the practitioners that are promoting themselves as the brand, they're being sorted out by patients. They're being sorted out by media to do stories on particular indications. Or companies are seeking them out because they want to work with them. And at the moment, I'm not seeing any examples of people using Shockwave to create their special hook. And I'm going to put in the chat some links of some people that have found their personal niche in social media. And I'm just waiting for a Mr. Shockwave Instagram page or TikTok page to be created, or a Mrs. Shockwave page to be created. And James, maybe that's going to be you.
I don't know about that. And what do you find? Because I know when I was just developing my website sort of recently, I think web developers get frustrated at us healthcare professionals because we almost try to write to other healthcare professionals. We're not necessarily. So, for consumers, what would be the things that, you'd find are really valuable things to highlight from a patient point of view? I think you highlighted a few of them before.
Definitely the highlighting the point of difference that Shockwave creates compared to steroids or being in a moon boot. But I think going back again to finding out who your audience is, do the research. There's many websites that I've gone to that just show images of older sort of patients, but looking at where their practice is located, and it's Bondi, or speaking to the practitioners and asking them, okay, who's your common audience? And they're saying, oh, youths between the ages of 25 and young adults, up to 35. So, but you're writing content that is then targeting the older generation. So I think it's really important to go back to the basics and do an analysis on who your customer is, and then creating content for those customers.
And for someone who, like myself, barely posts on their own social media, what would be some tips in terms of promoting yourself? What sort of content, I don't know, in terms of would you see that really cuts through in terms of what's a good way to promote yourself as the practitioner?
Look, definitely videos, and from a Facebook perspective, doing a lot of Facebook Lives. Now, it's just, if we're looking at Facebook as a chosen medium, their Facebook algorithm, there's no such thing as a free lunch on Facebook anymore. So if you're posting organically, testimonial from a patient, for example, or a nice picture of you next to the dollar class machine, all well and good, great, but you need to be putting some money behind that, and you don't need to be spending a huge amount. And if anyone wants to reach out to me, I'm happy to provide some tips on that. But using the Facebook Live, so and using the 360-degree video option, and also Facebook Stories. So just trying different means of communication. And as I said earlier, Shockwave's point of difference compared to the likes that are giving cortisone injections, focus on the fact that there's no medication, that you only need a couple of treatments, and the pain is thoroughly reduced. So just really focusing on your point of differences compared to competitors.
I think as a practitioner, it really is a no-brainer to use a treatment modality like Shockwave, which has such an excellent safety profile, is very effective. Before you start, injecting various substances, because they come with risks. As I said, doing an injection for plantar fasciitis, I always do under a nerve block. There's always risk of minor injury to the nerve, problems like
infection.
that. So infection, those things, these complications can be rare, but for the patient who potentially suffers them, they can be a serious problem. So if, for example, most patients, and you find that really before using Shockwave, I probably did more of that sort of stuff, and in clinics where I haven't had that. And that's one of the reasons I implemented into my own practice, because one, it's sort of time consuming, some of those injection therapies. Two, you've got risks to the patient. There's downtime that's involved. It's a whole bunch of things that can be. So it's really a no-brainer to do something that's non-invasive, something that's safe, something that's got a strong evidence base. And when you consider Shockwave, there's multiple trials comparing Shockwave to cortisone showing better efficacy in the long term compared to steroid. And one thing you find as well is if a patient has had multiple steroids and it hasn't worked, and they're still in pain, those patients can be really difficult to treat with Shockwave, or treat in general. In general, they can be very, very stubborn. So I always prefer, just from a tissue healing point of view, to always do something like Shockwave first, because you're going to reduce the effectiveness if you do it the other way around anyway.
Absolutely. And going back to when you mentioned about the referral letters, I just wanted to add a comment on that. I've found a lot of people having success by running referral evenings for their GPs or for their aged care practitioners, where they get them all in for a free evening with some nibblies and wine, obviously after lockdown, and getting them to feel the Shockwave on themselves. So offering them treatments. And that's been a real win-win for a lot of practitioners.
Yeah, it is really useful. People do like, touching, feeling, getting an idea of that, because They do, and I think they really do resonate when their patients are satisfied and their patients are getting a good outcome. That's one of the most of, I think, one of the best referral basis is getting good outcomes for your patients, and that's why I think it's, for me as a business owner, I'm unwilling to compromise on quality. And as we talked earlier, we've got over within the Pedro database, so 50% of those studies are using an EMS device. It's the only one with the FDA approval. I'm not willing to compromise basically, my reputation and clinical results with something that's not got the same evidence base behind it. If it costs more money, well, we've just sort of seen there, as long as it's factored in, I'd prefer to charge more in terms of the cost of that, as opposed to buying something that's cheaper, undercharging and not working very well for my patients. Because at the end of the day, what your patients value is the solution to the problem that they come and saw you for. It doesn't matter if you had a unit that was cheaper and you charged a cheaper price, but at the conclusion of their treatment, they hadn't had a significant improvement. That's not valuable to the patient. They don't see that as valuable. That's sort of money wasted.
Absolutely. James, are you ready for some questions? We've got a few here.
We do have some. Perfect.
Wonderful. So first of all, how do you bill Shockwave, with a specific code or as part of a longer consultation?
So generally, the way I generally, in my practice, it's, as I said, treatments that are in addition. So my Shockwave is in addition to a consultation fee. So the consultation fee is based on time, right? There's a brief consult, there's a standard consult, and there's a long consult. So it's based on how much time it takes. For a lot of Shockwave, it can often be done in a brief consultation. And the valuable thing with that is you're often able to touch base with the patient regularly. So you're seeing them every 4 weeks. So if they've had a bit of a flare up that week, you can often sit down with them and work out what's gone on. Okay, your activity's changed, or there's been a change at work or something like that. And it often really does improve your outcome anyway by doing that. But yeah, I charge a consultation fee and I charge Shockwave in addition to that. With a podiatry fee schedule, I use a 145, which is the item number. It generally doesn't, it falls under the electrophysical sort of category of ultrasound, therapeutic ultrasound and those things. It doesn't have a great, most rebates are very, very poor, if at all. You will find, however, that some of the newer private healthcare, they just cover a percentage. So they say, okay, if you've got physio coverage or podiatry coverage, we'll pay 50% or 80% of the bill until you hit your limit, and that's it. And it's not so much based on item numbers. And in those cases, Shockwave is covered really well because it's just part of the overall treatment plan there. Yeah. But we've, part of the roundtable discussion we had, there was basically 3 of us on there, and we all implemented it in a different way to our clinic. So there's not always a right or wrong way, but for me, the investment does have to help strengthen. If you make an investment in your business, it has to help build my business, and it also has to help make it more sustainable as well. Otherwise, if you make enough of those decisions, you eventually run out of the resources to continue. And you're no good to you're not providing that service to patients anymore.
Thanks, James. Rosie's asked here, can it be used for conservative management? Can it be, sorry, the question just went down the page. Can it be used for conservative management, i.e. reducing the cords and nodules of Dupuytren's disease in the hand?
Dupuytren's?
Yes, thank you.
It's much the same as, in the foot, there's a condition called plantar fibromatosis. Being a podiatrist, I'm not so familiar with treating hands, but it's the same sort of connective tissue disorder. In terms of it certainly can. I use it for plantar fibromatosis all the time, and it's my go-to treatment in most cases. Occasionally, when someone has even a large fibroma, and what these are is really we've got either our fascia in the hand or fascia under the foot. We don't fully understand exactly what causes it, but some people have a genetic predisposition to it. There may be some sort of minor injury, and we get this aberrant focal area of proliferation of the collagen, soft tissue, you get a nodule, and that can sometimes constrict over time as well. So in terms of, it depends what your outcome is. I find with plantar fibromatosis, it helps reduce the pain really well. It's really useful for that. Those patients, I often say, look, we do a course of treatment, and sometimes it settles it down for 12 months, sometimes it's 18 months, sometimes it's longer, and occasionally they'll come back and we'll do a top up, because the condition is, it doesn't go away with time. In terms of dissolving the fibroma, it's not really going to happen, but you are certainly going to free it up. It's certainly going to become a bit more mobile. But in terms of it, over time, it might shrink a little bit, but you're not going to get a drastic change in, if someone's got a fibroma, generally I'm looking for a reduction in pain. That's often what they're there for. They're coming in because it's sore and it's causing them pain. But yeah, it can be used on Dupuytren's, certainly.
What is the exact pricing that you charge for Shockwave treatment on top of the consult?
I charge. Well, look, there's a range of treatments. I charge probably to the higher end. There are the range would be, I know 2 clinics that charge $100 on top of. So we've got, I know a leading sports medicine clinic has an EMS unit. They charge $100 in addition to their practitioner consultation fee, and that's I charge around that $90 range in addition to the consult.
Hey, James, what are the top 3 to 4 conditions that Shockwave is best suited to treat that you've found?
So I find the big tendons in the lower leg are really good. So the plantar fascia, so plantar fasciosus, Achilles tendinopathy, particularly mid-portion, works really, really well. And even your greater trochanteric pain syndrome, it works really well for. Patellar tendinopathy as well. They're those sort of tendinopathies, I think, are the really big indications. There are other things that it works well on as well in terms of muscle spasticity and myofascial release and all those things. But in terms of, big bang for your buck, those sort of conditions I find you get really good outcomes with. And that's where I'm targeting most of sort of my Shockwave treatments.
Have you had any success with using Shockwave on plantar plate tear? I have a patient who wants to avoid surgery with conservative treatment.
So, you know what? It's a similar structure. To be honest, I don't use it much for plantar plate tears. I find that plantar plate tears really they can be managed conservatively quite well if it's purely a plantar plate tear. There are occasional patients where there can be a more substantial pathology. And there's probably 3 patients I can remember in the past few years who I've referred for surgery for a plantar plate. But the suspicion was always that there's something else. There's an osteochondral or there's something in the joint. And in all 3 cases, there was a significant cartilage defect in the joint. And one of the telltale signs of that is you've got this chronic synovitis that just won't get better of the MTP joint. And these patients don't progress at the same as your typical plantar plate patients. And in most cases, the surgeons text me a photo after the patient's out of surgery with this large bit of cartilage that's popped out of the joint that's been floating around in there, or there's been a reason why, and they've often had to do a realignment osteotomy to raise, to change the angle of that to reduce pressure on that area. Plantar plate tears in general, typically you find 99% of them really don't need surgical intervention. My approach there is accommodative padding. It's really important to take the plantar pressure away. This can be done with an orthotic, it can be done with felt pad. Strapping is really important for these as well, making sure that, and the strapping has to be for a significant period of time. Plantar plate strapping I do at least 2 months. And sometimes sort of 2 months and sometimes 3. And in that 3rd month, they're often sort of weaning off it a little bit, using it for activity and other things. In really severe cases, sometimes even putting those patients into a post-operative shoe for a period of time is helpful, with accommodation and things like that. Shockwave could be used. It really is very similar, that the plantar plate is part of your it's part of the plantar fascia in a way. It connects to it. And when you look at the ultrasound images of plantar plate pathology, it's actually really similar. It's similar to a plantar fascia in a way. If you look at the sort of cross-sectional shockwave ultrasound view, it can be really, really similar. So in general, I don't find I need to, because those other treatments tend to work. And with plantar plates, because it's so much depending on the pivoting of the joint, you've really got to focus your treatment, I think, on there. But shockwave could be used. It's just not one of the main indications. I don't tend to use it a whole lot, but I could see it being effective.
Is there any evidence to support its use in acute presentations?
So for acute presentations, generally, the evidence I would use, and shockwave can be used not so much in that acute injury, but sometimes with the spasticity or the sort of muscle spasm that can be associated with it. When we injure ourselves, what our body will naturally do, particularly in that early phase, is, and I describe this to patients as, it's a bit like when you sleep funny on your neck, and it feels like there's a little bit of a pinched nerve, and then you start to get all those trigger points that develop in the muscle, and things don't move quite the way that they should. When we've got an injury, we can often get some spasm in the muscles as it's trying to splint the affected area. And this can be detrimental to their early recovery when you're trying to get the moving. So I wouldn't use shockwave in an acute tendon injury or an acute injury on the spot, but I would potentially use it for the myofascial pain when you're trying to reduce spasm in the muscle. That's where it can be really useful in an acute injury. Sometimes even just dealing with really sort of hypersensitivity, you can use the larger applicator on the shockwave machine at a really high hertz at low bar pressure. And this can have almost a pain relieving effect. So it's not so much really, high intensity shockwave in the area of damage, but sometimes just to relieve some sensitization in the area. That can be really helpful. And look, I'm doing that at the moment for a patient who has more of a nerve type pathology, but she's not a really good surgical candidate. And in this case, we're really just trying to almost desensitize this area. She's failed. She's had 4 cortisone injections that haven't alleviated the pain. But, that's the sort of thing you can sometimes do.
You've had quite a bit of success then with the EMS laser for the acute injuries as well.
I have. Look, in particular, I'm using the EMS laser at the moment. Particularly what I've found the laser really useful is post-operative pain. So I've had a few patients, and even severe, I had a patient who was really quite uncontrolled pain following a small ankle fracture, a little avulsion fracture, having really difficulty managing it, even despite basically being immobilized. And the laser was really helpful to reduce pain and help with her approach. It reduced swelling and those things. One patient who was in, she described in one session of laser with the EMS, this is 5 weeks post-operative, she had more pain relief in that period of time than she'd had in the whole 5 weeks. And for her, it was just wearing her down because she wasn't sleeping properly. She was constantly awake due to pain, and that was really having an adverse effect. So, look, it's early days. I'm not super experienced in terms of using the EMS laser. It's new technology, but I'm finding some really positive success stories so far, and using it as part of the prior to shockwave therapy as well is, and we've got evidence looking at using the laser to relieve pain, before Shockwave, meaning that you can actually get more energy into the treatment. And we know that getting more energy often into the treatment is one of the things with success. So if you've got a patient who's having difficulty tolerating it, that's where even the EMS laser can be useful. But that sort of covers that early acute injury, can be really helpful, having the laser as a treatment option for patients.
Thanks, James. For patients with plantar spur pain and plantar fascial attachment pain, how do you tailor your approach with Shockwave, especially for those who have feet that are very sensitive to pain or are ticklish?
So a few things with that. One is to grip the heel quite tight. And I almost say, I tend to cup the heel. So I usually have the patient sitting up, but you can have the patient lying down as well. But I usually like them sitting up, sort of facing me. I'll grip the heel and almost put a bit of tension or traction onto it, because this sort of dampens any reverberation, makes the patient feel more comfortable as well. I do also tell those patients that, particularly if it's their first session, really you're in control. So I'm going to start on a low setting. And once you're comfortable, we're going to slowly work that up, but you're in control. If it's too much, if it's too uncomfortable, we can always turn it down. You're in control. And that helps patients feel a bit more relieved. And they're often more likely to say, look, yeah, you can actually turn it up a little bit. That's okay. You can go up a little bit. The other thing is, I often don't start right on the painful spot, first treatment. I start a little bit away from it. And then you slowly work your way towards that painful area. I tend to focus most of the Shockwave in the focal. Like I'll with palpation, you work out really where's that maximal point, and it's probably like 2 centimeter circle. That's where I deliver most of the energy for the treatment. Occasionally, if they've got arch pain as well, or there's an indication there's some myofascial pain in the arch, using the large applicator as well for myofascial release. This can also be useful too for sometimes patients, and these are more so patients with a higher arch foot, sometimes they can get almost a hypertrophy of the abductor hallucis muscle. And in heel pain, this can cause a bit of compression to the nerves, the medial lateral plantar nerves that pass in that space. And they can develop almost a referral pain from that. And we know with a lot of these injuries that there can often be multiple tissues that are contributing. So the patient may have plantar fasciopathy, but there may be some degree of mild, distal tarsal tunnel. Shockwave can be used to reduce the spasm in that. So I'll often use a larger applicator, really high hertz, and I'll treat that not on a really high bar pressure or high pressure, more so to reduce spasm in that abductor hallucis, and that can have an effect, can be really useful for those patients with more of a, who are potentially getting a bit of a distal tarsal tunnel syndrome. So it's not quite a true tarsal tunnel in the fact that they're getting sort of numbness and things like that, but it can be a contributing factor for certain patients.
Thanks, James. Just wondering if there is a lot of vibration on the user with long-term use of Shockwave.
To be honest, it's not something I noticed. There are like a silicon end piece that sort of goes on it, but the engineering is designed that our Shockwave goes in one direction, really. There is a little bit of kickback in the handle. There are, if that's something that's, I personally actually take the silicon off. I don't have them on mine, but they are designed, and the newer unit has a really nice handpiece as well. It's really user-friendly. You can also adjust, the really neat thing on the new unit is you can adjust the bar pressure and stuff just within the handle, which is really nice. It's not something that I notice myself, but there are, they do come with a little silicon protector, which really goes into the butt of your hand. So that will dampen anything even further.
And what's AMS is patented the compressed spring-loaded tip as well. So
yeah, so that's fantastic for those sort of getting into those deeper indications. It becomes sort of an extension of your. It becomes an extension of your hand, really, and you can actually feel the tissue too. You can really feel when you're in an area that's, and the patient will let you know as well. But yeah, that's really helpful because I have used other machines that don't have that, and it's a completely different feeling for the user.
Absolutely, absolutely. Looks like that's all the questions, but if anyone has any further questions, then please reach out to us. We're always available. And James, thank you so much for sharing your knowledge again. I always get such a great deal out of it, so I'm sure everyone else did too.
Thanks for everyone that joined. It's been really good. Thanks, Danny.
Thanks, everyone. Have a lovely evening. Bye.